Cervical Facet Syndrome. Your health and well-being is important to all of us. Today, your healthcare provider has requested that you watch this brief video. Do you have nagging neck pain that doesn't seem to go away? Has your work been affected by head and neck pain? Are you unable to be the best you can be because of your neck condition? Have you lost mobility in your neck movement? Over the next few minutes, you'll learn about a specific type of neck pain called facet syndrome, how it occurs, and what you can do to prevent pain and achieve a healthy spine. Facet syndrome of the neck occurs when the joints of the vertebrae in your spine are not gliding smoothly. The joints get fixated, or their alignment becomes restricted, affecting mobility of the neck. This often causes neck pain and pain radiating to the trapezius muscles of the upper shoulder. The facets, or joints of the neck vertebrae, are hinge-like and interconnect each vertebra to one another. When the facets are not gliding smoothly, they can compress and irritate the soft tissue, such as the joint capsules surrounding the facet joint complex. This can inflame the nerves exiting the spine and cause the same type of symptoms commonly seen with pinched nerve conditions. When a nerve root is compressed, it may cause symptoms of numbness, tingling, burning, and achy soreness along the nerve path. The nerves on the joint capsule surrounding the facet are very small and can be irritated if the facet joints are not gliding smoothly. Extension of the spine will often flare up a facet syndrome, as the joints of the vertebrae will be pushed closer together. Repetitive stress and arthritic changes to the facet joint can lead to narrowing of the space allowed for the spinal nerves to exit freely and function properly. If the spinal nerves are not functioning properly, they will not send correct information to the muscles and organs of that body region, causing potential weakness, spasms, and pain. Facet joint pain comes and goes and is made worse by sudden movement. Usually neck extension is the most painful movement with a facet syndrome. Extension of the spine causes the facets to jam together and cause pain and joint restriction, limiting movement. Patients with cervical facet joint syndrome often present with complaints of neck pain, headaches, and a limited range of motion. The pain is described as a dull aching discomfort in the back of the neck that sometimes radiates to the shoulder or mid-back regions. Patients may also report a history of a previous whiplash injury to the neck. During a whiplash injury, the head and neck are forcefully put into flexion and extension. This type of injury causes swelling of the tissues surrounding the spine and can cause a misalignment of the facet joints. Facet syndrome is a common and underappreciated cause of both acute and chronic neck pain and is commonly seen by healthcare professionals. Your healthcare provider can diagnose and address the cause of your pain and provide you with the education to heal and prevent flare-ups and recurrences. According to the Journal of the American Chiropractic Association, manual therapies, including spinal manipulation, are often helpful for facet syndrome. Therapeutic exercise through a pain-free range of motion also has value in treating facet syndrome. Muscle strengthening should begin with isometric exercises and progress to isotonic exercises as tolerated. Manual manipulation or chiropractic adjustments combined with exercise are very helpful. Using correct lifting techniques, ergonomic chairs, and good sleep posture all contribute to a healthy spine. Proper posture is facilitated by exercise and stretching, which tend to strengthen the muscles that stabilize the facet joints of the vertebrae. Any treatment for cervical facet syndrome should focus on restoring motion to the joints. Chiropractic adjustments are successful in relieving pain and improving joint function. Above all else, to avoid recurrent episodes of facet syndrome, follow your healthcare provider's instructions for healing and prevention. Your healthcare team has a star player, you. With you leading the way towards a better state of health, it is important to Keep all appointments. Follow your treatment plan for longer-lasting results. Exercise as instructed. Eat properly and follow stretching and ergonomic recommendations. Working together as a team, you and your healthcare professionals can decrease the likelihood of future problems and prevent degeneration from advancing, decrease relapses or flare-ups, and stop the development of chronic pain syndromes. A better quality of life is the wellness goal to better health. With proper spinal care and prevention, you're on the right path to achieving that goal. If you have additional questions about the information presented, please ask your healthcare provider for assistance.